have a problem in TB HIV? Yeah, we have problems. That's a very useless answer, because it really doesn't tell me what the problem is. But if they say to me, yeah, we have a problem, and our problem is that the uptake of CPT is only 20%, that is a problem I can start working with. Not just, oh yeah, programs always have problems. That doesn't help anybody. You want to be very specific about the what. What exactly is the problem? And this is where most people go off the rail, because the what is so unclear, it's so hazy, it's so undefined, that you don't, even when you do a flow chart, it's useless, because it just tells you nothing. Yeah, there's a general problem here. People here, That doesn't help me. Exactly what is the problem? Express it as something that can be addressed. Okay? So you really need to think about what your problem is. For example, here we said we have a high TB patient defaulter rate of 25%. That is directing you exactly where the problem is. Not, oh, we have a problem with patients. You get the difference? One is just a general statement. You are indicating there's a problem somewhere there. But this one tells you exactly where your problem is. What will be different when the problem is solved? Remember why we are doing this? We're trying to say is this problem really worth it? So what will be the difference? We want to determine, is that difference significant in terms of programmatic success? Is it really significant? Is it really worth wasting our time on? So what if we address defaulter rate? A program manager will say, woman, so what if we address the defaulter rate? I depend on the defaulter rate being low. Okay? I depend on that because I need my treatment success to be high, because that's the way I control the spread of TB. That's the way I look after my patients. So it's very important for me. So, you may say, why are you thinking through something so obvious? It's the obvious that makes us trip. We miss the obvious. The complicated, everybody looks for the complicated. But the obvious, we all walk past it, okay? So it's worth thinking through. When we solve this problem, what do we expect to see? Is that thing we are going to see worth the effort of solving the problem? So in our case, we say yes, because if we get a defaulter rate less than 1%, hooray! It means more people have completed treatment. If more people have completed treatment, there are fewer people spreading TB HIV, there are fewer people dying, there are fewer people sick, and we have a healthier group. Okay? So it is worth solving. Where? Why do you determine where? You want to localize exactly where the problem is, because you're thinking of where are we going to act. This problem of defaulter rate, does it occur in a whole country? Or is it in specific districts? Or is it in a hospital? Or is it just at a health facility? Where does it occur? Now, why is that important? Who can tell me? Because I can see some people already dozing. This room is very hot. Who can help me with that? Why? Where? Why is where important?
Because of the context.
Yes, because of the context. Exactly. Because when you're thinking about the causes, you say, what is peculiar about that hospital that is causing the defaulter rate to be high? Now, and the resource you're going to put in will be proportionate to where? If it's only one hospital, you're not going to have a national meeting to discuss what we're going to do about TB HIV. You're just going to go to that facility. And the where also gives you an idea of how big the problem is. Is it a widespread problem so that we really have to address it as an emergency, or is it a small problem that can be addressed by one supervisor? Are we together? So it's important to have the where. Where does it occur? Is it restricted? Is it general? Is it only a place that, in one place that it occurs? Where does it not occur? Because you want to know where it doesn't occur. Why? Because you can learn something from the areas where it does not occur. Why is it occurring here and not there? What is the difference? Okay. Secondly, you don't have to bother those that are not involved in the problem. You don't have to waste your resources. I must always keep in mind that every time you use manpower, it's resources you're utilizing. So we have to be careful about how we use the resources. Then the when. When does it occur? Is it every day? Once in a while? Once in a year? Is it seasonal? And why is the when important? Now, some problems are related to when, in the sense that the when is when people do certain things. Okay? For example, if you find a high defaulter rate during the farming season, what does that tell you? The problem may not be the hospital. The problem may be people are going farming first, and they don't have time to come and get their drugs. You know, they're busy that time. Therefore, it's not, you're not looking because they're drug stockouts or anything like that. You're more looking at what is the behavior of the population during that season that is causing this problem. So it gives you an idea of what is causing the problem. Okay? The other thing about when, is it only for a short time? Has it only happened once? Or is it a continuous thing that you really need to address? You see, if I'm late once in a year, I don't think my institution will start writing me memos and things about being late all the time. I've only been late once in a year. But if it's a chronic problem, every day I come in, sorry, my child was sick. The next day, no, I had to do something at home. The following day, no, I mean, it becomes a chronic problem. It has to be addressed. Okay? So that is why the when is important. Is it occurring all the time or only once? When does it occur? When does it not occur? How long has it been happening? Is this a new thing? Maybe it's something you've introduced that has this side effect, or is it an existing thing which you should deal with because it has gone into your system? So it's important also to answer those questions. Who? The who. Why is the who important? Who is the performer? Now, if we look at defaulter rate, who is involved? There's the health worker, presumably. Maybe there's a community health worker as well in the chain. Maybe, definitely there's the patient. Maybe there's a treatment supporter. So there are already four different people who could be causing the problem. Okay? So you need to know exactly who. When you go and investigate what is causing this, you want to know who do I ask? Where do I go? Where do I focus my attention? No good coming to ask me about defaulter rate. I don't touch any patient. Okay? So much as I can yab around and talk on and jab around for ages and ages, I'm not going to give you any answers. You need to zero in. Who exactly? Who is doing the performance? Is it a group? Is it a person? Is it 2 people, 3 people? Who is it? Then you have to be very clear, what is the desired performance? Because when you start dealing with who, you must also define what you are expecting from the who. This who, what are they supposed to be doing? Because that will tell you what they're doing and what they are not doing. Okay? What is going wrong? What are the others doing? Are they doing okay or are they not? Can you identify a performer that does it correctly? Because if you can find somebody who does it correctly, you've got somebody, a peer that they can learn from. So the who is also an important part of that pentagon. Then finally, worth. Having discussed all that, having been through all that, is this really a problem that affects quality, quantity, cost, and effectiveness? Because if you have somebody who says, if there's a problem that doesn't affect those things, then you really have to question whether it is worth doing. Because your program is about quality, the quality of the services you're giving, the quantity that you can manage, the volume, the cost. Is it cost effective, or are you wasting a lot of money doing useless things? And timeliness. We always talk about early detection of cases, prompt treatment, on time. For programs, that is very important. How does the outcome compare with other organizations? Now, this is important because sometimes you can say, we're performing poorly because you've set your standards unachievably high. We can do that. So it is good to stop and think, is our poor performance really poor performance? Or is it that our desired performance is so high that it's unattainable anyway? For example, I have a program that says, we are going to put 100% of our patients on ART. And when they put it as a target, I thought, wow, you're going to put 100% of your patients on ART? Oh yes, we really want to be the center. And I thought to myself, well, good luck. Because one, ART has a criteria. It's not every patient that is going to go on ART. The guidelines that govern who goes on ART, the side effects, the patient reactions themselves may not allow you to put them on ART. And when I came back for the second learning session with the ART uptake still 40%, I thought, what happened to your 100%? So, you see, the regulations are good. That is what you should have taken into account. So sometimes our performance can be unrealistic. So we have to be sure that it is actually realistic, it is contextualized, it is reality, it is in line with what is feasible. And as I've said before, this is really, I've said all this, I've covered this. Is it worth the cost of fixing it? How much does it cost the organization in money, in lives? Are there other problems that when fixed can give you a greater benefit? Okay? Problems come in the thousands. You have to decide, is this problem, the return on fixing this problem, is it really worth it? Or, in my situation, are there other problems that if I fix, I can get a greater return? That is something that you have to discuss within your context. Okay? So if you come to the end of the problem pentagon, you really should be able to intelligently discuss whether it's worth going on with a particular problem, solving it, or if it really doesn't warrant the investment. Okay. But always think of the return. If you're going, for example, say, you know what, to improve adherence to TB drugs, I think what we'll do is we'll fix people up in a secluded place and make sure we are watching them, and you're going to spend X thousands of dollars on it. Is it really a worthwhile thing? There are other things you could do with that money that could give you a bigger return in terms of public health than focusing on that one person to make sure they are comfortable so that they finish their drugs. You can do other things for them, but you don't have to blow all your budget on one person just to get adherence. It's that kind of thinking. Is it really cost effective? Is the return high enough? In public health, unfortunately, it's always about return for the general population.